Okay. Good night, everybody. Thanks for being here again. I welcome you to my webinar. It's the second part of a webinar that I did last week, which was about certain advices about going to the emergency room. Sorry. I want to thank Bribot for sponsoring this webinar. Before starting, I would like to just remind you that even though I'm a physician and I'm trying to give you good advice, this doesn't replace or tries to substitute you actually seeking help from a doctor. Okay, so we're gonna start. Okay, so should I stay or should I go? This is part two. I'm Jaime Mesa. For those who do not know me or haven't been in the past webinars, I'm a medical doctor, and most of my medical work was and is in the emergency room. I did mention certain data and certain statistics about a situation in my last webinar. I'm going to repeat that a little bit for those of you who are new. So 20% of the Americans visit the ER each year. Waiting time is, I think, one of the most important things, one of those factors that actually make you think if you actually should go or you should wait. Now, the average time it's about 60 minutes, and 5% of people that go to the ER will wait more than 3 hours. That, of course, depending on what condition takes them there. 1/3 of the patients who visit the ER, they do it because they either don't have health insurance or they don't have a way to communicate with their primary care physician. So they decide to go there to satisfy a need they have. Last webinar, we talked about some common causes of ER visit, which were chest pain, respiratory symptoms like cough, back pain, headache, and abdominal pain, and some other consults like trauma, broken bones, and cuts like that. Today, I'm bringing you some other common causes of ER visits, which are skin infections, fever, which is very, very common actually, vomiting, and ear pain. This is together with the other that I mentioned, this probably are the top 8 or 9 causes for the ER, for visiting the ER, sorry. So let's start with the skin infection. Well, there are many different skin infections, and they all start pretty much the same, either by a mosquito bite or pimple or any cut that you suffered in your skin anywhere. Basically, the wound starts to get red and swollen. And this image that's here, that's actually from what we call a pustule, which might have started as a regular pimple or as a mosquito bite. So definitely, if you have something similar to this and it's associated with fever, that means the infection is widespread, and you should definitely go to the ER, because you could develop something that we call sepsis, which is the systemic reaction to an infection that might endanger your life. So yeah, it is definitely go if you have fever. If it's located 2-inch near your eyes, like this area near your eyes, you should go. Why? Because skin infections that are near your eyes might get actually into the eye or and touch the optic nerve, and that way go easily to your brain. So it is actually an emergency. That doesn't necessarily mean that it's going to be difficult to treat, but that means that it has to be treated inside the hospital. So that's a definitely reason to go to the ER. If the infection is in a child who's under 5 years of age, for many reasons. One of them is because they cannot tell you the exact symptoms that they have. So they might be hiding the symptoms because they don't want to go to the doctor. The other is that their immune system is not well developed. So they might either develop a more aggressive response or not even an appropriate response. So you might underestimate what's happening. So please take them to the hospital. And of course, like I mentioned with many other conditions, immunosuppressed people, patients should go to the ER, meaning that you're taking steroids for a long time, that you're HIV positive, that you were born with a immunodeficiency, or that you're taking certain medications like the biologicals for arthritis or certain conditions like that. You should go to the ER. In the other hand, if it's something that started as a pimple or as a mosquito bite, it's the redness, the part that's red around the actual infection, the point there, it's growing slowly. If it was after you scratch or you shaved, and it's not affecting the mobility of the place you have it, and you haven't gone to any tropical areas, meaning South America, Central America, or certain places in Africa, then probably you can wait and try to do certain things in home before going to the emergency room if you need to. Also very important that I forgot, I thought I write it there, but is if it's located in a joint, like on your knee, on your shoulder, on your elbow, that's another reason to visit the ER, because it's very likely the infection to go into the joint and then cause a more severe reaction. So what to do? I mean, most of us have had a certain reaction to mosquito bites or to pimples or things like that, and we know that necessarily doesn't mean you have to go to the ER. They're pretty they solve by themselves. But in case you're having one that's slowing, that has taken some time and you don't know exactly what you should do, well, the first thing that you should do is take a marker or a pen and just mark it. Like take the red area and draw a line throughout out the borders, so you know how fast it's growing or if it's actually decreasing the size. Because this is very, very important, because the speed of the growth, it's a factor that we take into account in the emergency room, because very aggressive infections grow very fast. So that's like an alarm. So you should do it even if you're at home. It shouldn't grow. It should always diminish in size. Just regularly wash the wound with regular soap and water. Try not to use so many disinfectant soaps or things like that, because they can actually help certain organisms to colonize the area and make the infection worse. Do not cover the wound because it needs to breathe. So just let it be in contact with air, and just wash it with regular water and soap. Do not use steroid cream like hydrocortisone cream or triamcinolone cream, because I know since they're over the counter, some of them, and they're very effective to certain skin rashes. People trying to use it in everything they have in the skin, but since the steroids actually diminish the capacity of the immune system to fight an infection, obviously this will make these kinds of things worse. Put a hot compress or a hot towel in the place where you have the the infection. Uh, Even, I mean, it's better if you have a point where you see there might be probably some drainage, like the white spot you saw on the previous slide that I had, and try to do certain massage, trying to take all the content to the center of the injury, of the lesion. And eventually with the hot and with that, maybe not the same day, but in a couple of days, it will drain by itself. Because number one rule for an abscess, which is a cavity that has liquid in it, is you have to drain it. So if you go to the emergency room, they're going to do it, but that doesn't mean you can do it at home. You can do it at a certain point of view. I mean, if the conditions I said were your case, so you can do it this way. That doesn't mean also that every skin infection has to drain. So only the ones that are very big and you feel like there's liquid underneath, you should drain it. The rest of them, you can leave them alone and do the other things. And of course, the last thing, but it's also important, take non-steroidal anti-inflammatories. They not only help for the pain, because these things actually do hurt a lot, but they help with the inflammation and the swelling. So yeah, you can take ibuprofen or naproxen if you wish. Always taking care, of course, of possible bleeding. So don't take them for a long time. I wouldn't say more than 7 days. Fever. Well, fever is one of the most common reasons for visiting the ER. Fever is associated with many conditions, but many the people they do not go because of the conditions they have. They go because of the fever, which is actually not the way it should be. But I guess we grew up with a certain fear of fever. So fever almost never is a condition by itself, so it's always like a way for other condition to manifest, or at least that the body is fighting against an infection. But if you have 3 or more days of fever, and I'm very it's very important for you to take the temperature with the device you like, oral or axillary temperature if you're an adult. And if it's greater than 100.4 degrees Fahrenheit, that's fever. Less than that, it's not a fever, so that's normal. But if you got 3 or more days of that, probably you should go to the ER just to make sure that whatever the immune system is fighting against, I mean, it's under control. That doesn't mean they're not going to do, I mean, they're going to do things. They might simply do a routine blood work and do not give you anything, but at least they will try to figure out if everything's under control. If you have traveled to tropical and subtropical countries, like I said before, because of course you have the chance to get one of those conditions, diseases like Zika, which is very, well, not common here in the US, but it is now. Everybody knows about it because it has been in the media. Or dengue fever or yellow fever, you could have it. So definitely in the past probably 20 or 25 days, if you travel to one of those countries, probably you should go to the ER and mention that, of course. If it's associated with any neurological symptoms like that you're feeling sleepy, or somebody, your family member that has the fever, it's difficult to wake up, it's always trying to sleep. If you're seeing things, you're hearing things, you have neck stiffness, that's another one, you should go to the ER, because neurological infections need to be treated as fast as possible. And it's very important for you to know that it's not acceptable to have any neurological symptoms. If you have febrile seizures, which are the seizures that are caused by fever, of course, you might want to go there. And there's something I want to explain about this, because there are certain myths about fever, that if you let your fever go more than certain degrees, it can damage your brain, or you can actually, people think that a fever causes meningitis, which is an infection in the central nervous system, or that it causes seizures. Well, those are myths. It's not how it works. I mean, there is a condition that is called febrile seizures, but I mean, very little patients have it actually. Uh, it's only when you're between 3 and 5 years of age, maybe younger, but never past 6 years of age. So if you seize and you have a fever, that's considered a neurological symptom. So you should go to the ER also. And of course, the same old immunosuppression, you should go definitely, because for immunosuppressed patients, there's a different threshold for what they call fever. So probably at 100 degrees, I would already be going to either the ER or at least your primary care, so he or she can run some tests to see what's happening. But if your fever is associated with common symptoms like runny nose or stuffy nose or sinus pressure or pain, or you have headaches or chills, which are very common, or it's associated with respiratory symptoms like cough or a low-grade fever, probably that's okay for you to stay home and try to do certain things first. It's actually, the fever is the natural reaction of the body to try to fight against certain organisms. As you know, I mean, if you want to kill the bacteria from water, you should boil it. Well, in a certain way, that's what the body tries to do, increasing the body temperature to kill the bacteria or parasites that you might have. It's very effective. So in a certain way, we shouldn't try to stop fever, but we do, because patients feel like body ache, or they don't feel well, and the cause of that is the fever, the whole immunological reaction to the fever. But you could perfectly live with 104, 101 actually, with not that much of a problems. But if you want to do something, well, you should try use warm water towels in your forehead and your neck, because there are main blood vessels going through your neck, so that will help you cool down a little bit. Do not cover yourself, because that is something a lot of people do. They have fever and they just go in bed, they put like tons of clothing and the bedspread and blankets. So of course, if you do that, your fever is only going to get worse. So try to be on your regular pajamas or like regular clothing, and probably your temperature will be controlled that way. Always check your temperature. If you can do it like every hour or two, to see if you have different variations of the temperature, or certain fevers only spike once in a night or once every 3 nights. So that will be helpful in case you need medical attention, or at least some people think they still have fever when the fever went, I mean, 2 hours ago they went off. So you should monitor your temperature all the time. And of course, yeah, you should try to take certain medications. Acetaminophen, it's a good medication for fever. Or if you have something else, maybe ibuprofen or naproxen, even aspirin, but now not many doctors recommend aspirin for fever, especially in young patients, because they might have a risk of developing Ray's syndrome, which which is a complication in the liver, but it's very uncommon, and it's more associated with fever caused by the chicken pox. So, well, probably you should stick to acetaminophen or ibuprofen. And I said it last time, but I will repeat it. Try not to use antibiotics, even if you had them from a previous infection that you had, urinary or skin infection or respiratory infection. Maybe you have some antibiotics that were left, and you say, well, I had the fever last time and doctor prescribed this, then why shouldn't I take it? Well, you have to know that right now bacterial resistance is a big deal, and probably we are running out of usable antibiotics for certain infections. So by doing that, probably you're contributing to that, and might be more difficult in the future to do it. Most fevers are caused by viruses, not bacteria, so antibiotics won't work. So try not to do it, or at least that's my advice. Vomiting, very, very common also. It might be um, also the way of certain conditions to manifest. Many different conditions, but uh, also viral infections and regular like food poisoning or irritation to your stomach or bowel are the most common causes. If you have, if you're vomiting after trauma, you should go. It's both a symptom of neurological damage and also that some abdominal damage could have been done in your trauma, car accident, uh, I don't know, a fall from certain height, well, things like that. It definitely, if you're vomiting blood or your vomit, it's black, because there are not many black things that you eat. So if you're vomiting black, probably that's the blood that's been digested and you're just throwing it up. So it's a reason to go to the ER if it comes with severe abdominal pain. Because I mean, if you vomited for 3 or 4 times, you'll start having certain abdominal pain. But if this is like an excruciating pain, you should definitely go. If you're constipated, I mean severely. I mean, if you haven't gone to the bathroom for, I don't know, 2 3 days, if you're not passing gas, you should definitely go, because you might have obstructed bowel, especially if you had any history of any abdominal surgeries. You should go. It doesn't matter if they were 10 20 years ago, you should. Or if you have any neurological symptoms, you should also go. And if there are multiple episodes in 1 hour, it's, I have stars there. I wrote more than 5, but that's, the stars are because that's relative to the person. I mean, certain people can withstand more than 5 episodes of vomiting in 1 hour if they were not very big, but if you, some others will dehydrate faster. The reason why you should go is not because maybe that's from a certain condition that's very bad, but it's just because the the risk of dehydration it's very high. So you should probably seek a way to be rehydrated by with an IV. So you should go. Of course, I didn't put that, but children should always go, because the kidneys in children work different from adults, and they are easily dehydrated. So they should always go if they're having multiple episodes, more than 3 or something like that. But if you're vomiting after a heavy food, or the night before you had certain drinks and you're not feeling well, or you have flu-like symptoms and you just don't feel like going to work because you're feeling dizzy and you have body ache and you vomit, well, probably that's because it's together with the whole viral infection. And of course, motion sickness. If you've been traveling in like in a road trip for a long time, or you were in a ride in an amusement park or something like that, well, probably you shouldn't go to the ER. I mean, you can treat it at home, or try never to induce vomiting. Why? Because I mean, although certain people feel certain relief after vomiting, so they try to do that. For certain people, it's actually difficult to do it, and they what they might cause, it's a certain tear in the muscles of the stomach, because you try and try, and maybe you don't have anything else to vomit, and you're just feeling nauseous. And after that, you might cause gastric bleeding. So try not to do it. Of course, Also, inducing vomit might cause erosion of the esophagus. That is also a very bad thing to do. It's actually very painful, so I wouldn't recommend it. Um, Obviously, stop eating or drinking things, anything. So you should go rest and do not drink anything, not even water at first. Try to do that for an hour at least. Uh, and if you stop vomiting without drinking or eating anything, then you might start something liquid. Obviously, the number one choice would be rehydration salts, oral rehydration salts. Uh, the brand that you like. I mean, Pedialyte is very common, but you can choose whatever you like. Or you can, or if you're in a place where you don't have the means to get rehydration salts, you can actually do it yourself. I may warn you, it might not taste great, but it will actually work very well. So in 5 cups of water, which is a liter, you can put 8 teaspoons of sugar and 1 teaspoon of salt. Mix it up and start drinking that very slowly. Never, I mean, you're gonna be thirsty because, of course, if you're dehydrated, you're gonna be thirsty. But try to drink this very slowly, other else you're gonna start vomiting again. Then, if you accept that, you can have something more strong, something stronger. Um, Ginger is very good for vomiting and nausea, so you can use it. Actually, there are lots of studies that show that this is extremely good. Actually, I gave it to the pregnant patients who are having like bad time because they're throwing up all the time. So ginger is very good. You should try it. And of course, then restart the diet with certain things like chicken with not a lot of spices and rice, and then start going back to normal. Ear pain is one of the most common reasons to visit the ER, especially at least from where I am, which is Florida, because there are a lot of lakes, pools, and of course the ocean. There are different conditions that might cause ear pain. That goes from the inside of the ear to the outside, or to the joint of the jaw. That is also a common cause, but definitely if it was after trauma, you should definitely go, because either you might have your jaw fractured, or you might have certain internal bones of your skull fractured. Then you should go, especially if you're bleeding. You should definitely go. If there's a smelly discharge coming off your ear, then you should definitely go and get that checked out. If you suspect that a foreign body could be there, and this is for adults, it's not as common as for children, but for children it's very, very, very common. I mean, they put pencils, they put, I don't know, peas, they put whatever fits in the ear, they try to put it there, and eventually it's not gonna get out. So if you think your child might have put something inside the ear, well, take them to the ER or to a doctor as soon as possible. Foreign body can also be an insect, and that is very, very common. Of course, you're going to know. Having something inside of the ear that's moving, it's actually a very terrifying sensation. So try to stay calm. Some people cannot even move or talk after this happens. So try to stay calm and tell somebody what's happening so they can take it to the ER, because when that starts moving, you're going to start screaming, and probably they might think that something else is happening, and that you're not going to get the attention that you want. But yeah, those are reasons to visit the ER. But if the pain started after a long road trip, or a plane trip, or it's associated with flu symptoms, if it's one side, in only one ear, I mean, and if you have certain bubbling sound, like when you swallow, That's probably because you have otitis media, or at least certain pressure in the middle ear, and that can be treated at home. Maybe you've heard that otitis media is treated with antibiotics, but the actual guidelines for treating that only require antibiotics for children 6 months or younger. So if your child is 1 year, or if it's you who are an adult, probably that's not going to be necessary. In most cases, I mean, of course, there are certain exceptions to the rule. Here I put medication first because ear pain is one of the most terrible pains you could have. It's very, very, very bad, and that's actually what we do in the emergency room, is trying to calm the pain and not necessarily the infection. So yeah, try to take certain anti-inflammatories. Again, the same anti-inflammatories. They will help. Try to use, you can rinse your nose with water, I mean boiled water after it cools down, or you could use certain over-the-counter medication like Afrin, which is oxymetazoline. What it does, it's constricts the blood vessels in your nose, and I know I'm talking about the ear, so I'm going to explain that the middle ear connects with the back portion of your nose and mouth, and if you constrict the blood vessels there, probably the opening between the middle ear and the nose, it's gonna widen and liquid might get out, or air, in case you were on a trip in an airplane or in a car and you're feeling that like you're not hearing well and you have a lot of pain, probably that might help you. Antihistamines, which some are over the counter, like Allegra or cetirizine, they will do a similar effect to the Afrin that I just said. Try to take or use certain natural herbs. Chamomile, in this case, it's helps soothe certain pain in the ear, so I would do it. I would take the chamomile and do an infusion, like let it boil in water for about 20 to 30 minutes, and then let it cool down and put it with a little, some drops on your ear. This might help. And put some warm towel on your ear, on your jaw. That might help you calm down the pain. I need to warn you that, of course, it's not necessarily going to resolve the problem right away. Even if you go to the ER and they do give you antibiotics, ear problems and infections tend to last for a little bit, like 4 or 5 days. And sometimes they bother a lot because you cannot hear through one of your ears. So just be patient and it will go away in most of the cases. If you start bleeding or having discharge, like I said, well, you should go to the ER. Well, thank you. Those are just some of the reasons why you may want to visit the ER. I hope you liked it, and this complements the other webinar that I did. Now I'm going to give some time for some questions that I really enjoy. So feel free to do them, and if you have any suggestions, I'm listening.
Dr. Jamie, I have a question.
Sure.
I had read in a medical journal years ago that if you get an insect in your ear, you can pour vegetable oil in your ear to kill the insect without harming your ear tissue. Is that something that works or that you recommend?
Well, in my experience, I wouldn't actually pour any liquid when you have an insect in your ear, no matter if it's already dead or it's still alive. The reason why I wouldn't recommend it is because sometimes certain insects or most insects actually, when you put liquid, they die and they start to absorb and swell with the liquid. So they might become actually more difficult to remove and they're going to be more painful. So I wouldn't do it. I would just go straight to the ER and try to remove it with the adequate tools.
Okay. And one more question, sir.
Yeah.
Would you recommend over-the-counter anti-vomiting medications?
I guess it depends on the case. In my experience, they help for certain people. For example, if they have gastritis or peptic ulcer or things like that, and that is the cause of the vomiting, they might help. But in most cases, only, vomiting and just resting your stomach will be enough. So I wouldn't say it's contraindicated. I wouldn't say I wouldn't do it. You can do it if you want, but simply don't rely necessarily on that. You can try it, but also try the other things I said that might be also very helpful. So I would try it, yeah.
Okay, thank you.
You're welcome.
Dr. Jamie, when you first started, you mentioned the mosquitoes with the dengue fever. I
Yes.
have a niece in the country that I'm from who died yesterday morning because she was bitten with one of these infected mosquitoes. And you said the mosquitoes creates a neurological problem.
Well, first of all, I'm very sorry to hear that. I'm very, very sorry.
Thank you.
I'm from Colombia, which is a tropical country, and we have a lot of that. Actually, myself, I had Zika virus when I was there. So I know how terrible it can be, and dengue fever. So I'm very, very sorry to hear that. Dengue can cause neurological symptoms, actually. It's the least population. It's very uncommon, but it's very dangerous. It's like the most dangerous manifestation of dengue. Actually, the normal way the dengue goes, the natural history of the disease, how we call it, is that you get you get bitten by the mosquito in a certain days, like 7 to, I think it's 20 days or something like that. You develop a fever, and certain cells in your blood start to change, meaning some start to go up and some down, being the platelets, the cells that diminished and might actually cause bleeding. That's why it used to be called hemorrhagic dengue. But it usually has 3 days. When the fever stops and you don't have any more fever, the next 3 days are the most dangerous. We call that the critical phase. But if nothing happens on those 3 days, probably you're gonna get better eventually. There's no current treatment for dengue, so probably you just go and you get hydrated, you get monitored, but there's not really much we can actually do for that. But unfortunately, a small percentage of people do get infected and a reaction in the brain that calls what we call encephalopathy by dengue, which is very deadly. And I don't know if this is what happened in the case of your family member, but it can happen. Not always. It's rare, but it can happen. Yeah.
Exactly what really happened. Because I am from Guyana, and because of her work, she had to go to certain parts of the interior, and she was bitten by the mosquitoes. So this is what she was diagnosed with. She was hospitalized for 2 weeks, and the private hospital said there was nothing more they can do, so.
Yeah, that's very unfortunate. most cases of dengue fever are like a very bad flu, but nothing more. But some few cases actually develop certain other symptoms, either hemorrhagic by gastric bleeding or brain bleeding or joint bleeding, and some even fewer cases develop neurological symptoms. And since I tell you, we don't have any treatment for that, so unfortunately, there's actually very little we can do for those patients.
Could you spell that word for me, please? Hemorrhagic?
Spell?
Yes.
Well, that would be a difficult one, but I will do it. It's
Yeah.
H-E-M
Mm-hmm.
O-R-R.
Uh-huh.
I think it's A-G-E, but I'm not sure if it has an H. Let me. Do you want me to spell hemorrhagic dengue or just hemorrhage?
Because I'd like to pass this on to them to see if they can, find out.
Right. So it's H-A-R-R. I mean, sorry. H-E-M, sorry.
Uh-huh.
O-R-R-A-G-H-I-C.
Uh-huh.
That's hemorrhagic, and then just dengue, hemorrhagic dengue. That's how we used to call it. You can read, probably there's still a lot of information about it.
Okay.
Okay, thank you for your
Thank
question.
you very much.
You're welcome.
Dr. Jamie,
Yes.
would you suggest putting a couple drops of peroxide in the air if there's any kind of infection going on?
Oh, drops of what? Sorry?
Hydrogen peroxide.
Hydrogen peroxide, it's very used for treating what we call impactations, which is like the wax gets stuck in your ear, because since it starts bubbling, it helps that wax come out easily. And in a certain way, if you mix it with regular water, it can be helpful. But you just, I don't like it because certain people have reactions, and if you leave the oxygen peroxide for a long time or it goes in and you cannot wash it out properly, it will burn. It's very what we call caustic. So you actually can try it. Many people use it for dyeing their hair, and you feel like when you have it on your head or on your arms for a long time, it starts burning. So it might actually worsen certain symptoms. I would recommend it if you do not have pain, only if you have like difficulty hearing and you might think it's because of wax, I would use it. But if you had pain, I wouldn't recommend it because it might worsen it.
Okay, thank you.
Okay, you're welcome.
So back to when you were talking about if you had a pustule on the joint, is it possible that that could mean something more serious is already going on in the body, or is it more of the fear that something could happen instead?
Yeah, it's more that it could happen. I mean, it might be pretty normal for you to develop a pustula in your knee or in your elbow or in your shoulder, in any joint. I mean, that's normal. It doesn't mean anything different from getting it somewhere else in the body, but it's just that you should be more careful with those places because if you get it in the middle of your leg or your arm, it may go deep in your skin, but it will have to go through your muscle, your fat, then your muscle, and then at last going into the bone. But in your joints, it will just go straight from your skin, probably a little layer of fat, and then straight to the bone or to the joint. And you will end up having to get surgery or something, big surgery or something like that for a simple thing. So that's basically the reason.
Yeah. You were talking about if there's nerve damage, or I don't remember the term neuropathy. It wasn't neuropathy, but if there was a neurological condition, I think you said, and with a neurological condition, regardless of what it is, you have to go to the emergency room. And you said that a stiff neck may be the result of some neurological condition. So how am I supposed to know whether or not, tingling in my body or stiffness in some part of my body, specifically my neck, or really it doesn't have to be my neck? How am I supposed to know whether that's a result of a neurological problem or whether it's just a result of some other type of problem?
Well, stiffness in the of the neck, it's a common sign of meningitis, which is an infection of the layers that cover the nervous system, the brain, and the marrow, the medulla, as we call it. Of course, not everybody that has a stiff neck has meningitis, but if you have certain things that are associated with that, like for example, for instance, if you have an infection, of course, number one thing is that you're going to have a fever. So if you have a fever and you also have a headache and you have a stiff neck, which means even when you try to move it, it's very difficult, even when you touch it or someone else tries to move it, and it results in a very painful sensation or in a lot of pain, then you should go. Probably if you don't have a fever and if you don't have any other symptom and you just have a stiff neck, probably it might be something muscular. But if you have certain things that are telling you that you might have an infection, being fever number one, then stiff neck, it's like an alarm that you should at least get checked. Other things that might help you with that is that bending your legs towards your chest, like putting your knees on your chest. If that movement, it's painful also, like your back or your head hurts, like that makes you have a headache together with the stiff neck, that's also a sign of meningitis, so you should go. That's basically like a little guidance of that symptom.
But if I'm not concerned specifically with meningitis, and I'm just concerned in general with having some type of neurological problem, how could I determine whether or not I have a problem that's worthy of going to the emergency room, or conversely, whether or not a visit to the emergency room might not be necessary?
Well, when I use the term neurological condition, I mean, there's a broad spectrum of conditions that might be there: central nervous system and peripheral nervous system. Of course, the ones that are actually emergencies mostly are the ones that are related with the central nervous system. Of course, there are certain exceptions, but like tingling in your hands, or numbness of your hands or your fingers, or feeling a painful sensation when you just should feel only, I mean, if somebody touches you gently and you feel like they're burning you or something like that, that means you probably have certain nerve damage. But that doesn't necessarily mean it should go to the ER unless it was something very recent, like a trauma or something like that. But having seizures or having a hand that it's moving without you controlling, like you're having a seizure, because people think seizures are just the whole body, but sometimes you can even have like a trembling hand. If that's something out of the normal, you should go to the ER. Like seizures, stiff neck, any part of your body moving without you controlling it, probably you should go.
Thank you.
Okay, you're welcome. Well, okay, I think that's all for for tonight. Thank you very much for being here. I'm gonna thank again Breitbart.com for sponsoring this webinar. I hope we can meet next week in a future webinar. And I really enjoy your questions, so please, I encourage you to keep asking and keep coming to this webinars, and have a very good night.